Keeping the body active throughout life is one way to help minimize chronic conditions, as well as keeping pain at bay. The American Academy of Orthopedic Surgeons reports that physical activity is both safe and beneficial for people with arthritis, osteoporosis, and other chronic conditions of bones and joints. A recent study by the National Center on Health, Physical Activity and Disability found that, quote, engaging in strenuous physical activity at least once a week was protective for incidence of lower back pain in this population of adults aged 70 to 100. Prevention of lower back pain may be yet another reason to promote and partake in regular physical activity for older adults, end quote. If you have a chronic condition affecting your muscles, joints, or bones, a lack of physical activity can make the condition worse, or at least make it more difficult to live with. We spoke with a specialist at Gulfcoast Spine Institute.
My patients' first question to me most of the time is, Doc, how long until I can get back to golfing? You know, they don't want to just get rid of their pain. They want to be able to get rid of their pain and go back to golfing or playing pickleball or riding horses. Average age in the villages runs around 74. But they're extremely active people with exercise programs 4 and 5 times a week and golfing several times a week.
The most common symptoms are back pain, spinal stenosis, which causes leg pain, weakness. We do a lot of failed back surgeries that have been performed by other surgeons, and we're actually able to correct failed back surgeries through minimally invasive techniques, even though they had traditional spine surgery. And all of our stuff that we do is Medicare approved, and we operate out of Medicare facilities.
I think what sets us apart at Gulfcoast Spine is that we do almost all of our surgeries in the lumbar spine through minimally invasive techniques. When you do something with little incisions, you have much less blood loss, much less post-op pain. And more importantly, you're not destroying the back muscle to get down to the backbone. You're leaving the muscle attached to the bone so that the patient doesn't have to rehab that back muscle. A lot of the post-op pain, blood loss, and rehab from open procedures is because of the actual surgical approach. Not so much from what you've done to the bone or the repair on the bone or the fusion, but how much destruction you've made to the soft tissues to do that. With the minimally invasive surgery, we're able to make small incisions, work through the muscle, essentially underneath the muscle belly, and do the exact same process on the bone, whether it be to stabilize it or take pressure off a nerve. And then when we withdraw these small tubular retractors through the muscle's left unharmed and works and functions properly. So we have very little blood loss, extremely low infection rate, and a very quick return to normal daily life and activities.
For more information about the Medicare-covered treatment options available at Gulfcoast Spine Institute, click on the Keep Moving StoryLink icon on our homepage at yourhometownhealth.com.